Hi friends, I'm Dr. Andrew Prue. Welcome to my YouTube channel that talks about the science and psychology of addiction. In this video, I'll explain why addiction is referred to as a disease and why it matters. The information in this video is taken from my book, What Happened to Me? Why People Become Addicted, Our Brain, Genetics, and Psychology in Addiction and Recovery, which is available from Amazon. If you're interested in taking a look, I provided a link in the description below. If you are the loved one of someone who suffers from addiction, please check out my book, Understanding and Helping an Addict and Keeping Your Sanity, which is also available from Amazon. If you're interested in taking a look, I've provided a link in the description below. All the information provided today is evidence-based, supported by the latest research evidence, and is also based on my experience as a doctor, an addiction researcher, and as an addict and alcoholic in recovery. I'm Dr. Andrew Prue. I practice as a doctor in the ER, hospital, and office settings, and as a psychotherapist for 15 years. I went through a low-bottom addiction to opioid painkillers and alcohol, and I've been in recovery since September 2016. Since being in recovery, I went back to school to do my PhD in the Neuropsychology of Addiction, and I've worked as a researcher, writer, and consultant on matters of substance addiction. If you'd like to know more about me, I've included a list of my credentials and a brief outline of my story in the description below. So let's get to it. Some people really get their back up and seem offended when addiction is referred to as a disease. After all, it's a choice, not a disease, right? Well, when I was in general practice, I didn't really buy into the disease idea of addiction either, because I too believed that people with addiction were just bad people who woke up every day and made bad decisions. However, since being through addiction myself and becoming an addictions researcher, I've become convinced that the disease model of addiction is entirely correct. But who cares though? Why does it matter if we call it a disease or not? Well, it does matter for a couple of important reasons. When we classify addiction as a disease, it helps break down the terrible stigma that burdens people with addiction and presents a barrier to recovery. It helps people understand that by the time someone has crossed the line into addiction, they've long ago lost the freedom of choice over their substance use and are now displaying the symptoms of a brain disease brought on by the toxic effects of repeated substance use. Although in the very beginning drinking alcohol or using drugs was a choice, the ability to choose has been lost. Otherwise, addicts would do what everybody else does, stop the substance use when it begins tearing down their life and making them miserable. In this video, we'll discuss exactly why addiction qualifies as a disease. If you're skeptical, I ask only that you keep an open mind. I too was skeptical once, but developments in neuroscience over the past decade have provided irrefutable objective support for the disease model of addiction. So what is a disease? A disease is something that disrupts the normal function of some part of our body, causes symptoms that make us ill, and is caused by some internal malfunction such as DNA abnormalities, or by an external factor that gains access to our body and plays havoc with some part of our body. A disease may be caused by various agents, such as infection, inflammation, genetic defects, toxins, or environmental factors. Many diseases propagate themselves by using our body's own natural processes. For example, a pneumonia virus causes disease by entering our body and then using our lung tissue to reproduce itself, causing havoc in our lungs. The virus uses our own cells' DNA and other machinery to make a whole bunch of baby viruses that spill out from the cell and go on to invade other cells. The result is the specific signs and symptoms that are caused by the virus's effects on our lungs, such as cough, fever, and shortness of breath. These signs and symptoms are what we know of as the disease of pneumonia. Like viruses, drugs and alcohol are foreign substances that enter the body and alter the body's natural functions to propagate their continued use. In their case, they invade the brain, where they cause specific physical changes that produce the signs and symptoms that we know of as addiction. They enter brain cells and use our own DNA to make changes in our brain that propagate the substance use. These are real changes that can be seen on MRI scans and under the microscope. Like many diseases, addiction has a strong genetic component that makes some individuals more susceptible than others. Viral infections cause our immune system to activate, and much of the illness that we get is from our immune system trying to fight off the virus. The fever, chills, weakness, and general unwell feeling that we get from viral infections are largely the result of our immune system activation. Addictive substances also cause an activation of the brain's immune system, resulting in harmful inflammation, just like what happens with viral infections. One feature of viral infections is that they cause the same set of symptoms in everyone, regardless of race, culture, age, or gender. The same can be said of addiction. Whether an individual grew up in Japan or England, is young or old, is male or female, is educated or not, whether they're rich or poor, the symptoms of addiction are remarkably consistent between individuals. The same can be said of other diseases like cancer or diabetes. The brain changes brought on by repeated addictive substance use alter the structure and function of the brain in a significant way, producing the pathological thought processes and behaviors that make up the symptoms of addiction. The altered brain effects promote continued substance use, create barriers to seeking and accepting help, and favor relapse in those who attempt to stop. Non-addicted people will halt their drug or alcohol use once it begins causing them problems. However, once addiction develops, such agency over substance use is gone. Even when the substance use is destroying their relationships and their health and livelihood and happiness and is no longer fun, people with addiction are unable to stop without proper treatment, despite the earnest desire to stop and multiple attempts to do so. At that point, they're under the power of a disease, and they're no more able to make it go away than cancer victims can make their malignancy go away. Over time, the concept of what is or isn't a disease has wavered and has undergone some very unfortunate and unscientific twists and turns. The disease definition has often been influenced by opportunity for profit, by private industry, or by political expediency, and by public stigma and beliefs rather than by science. Addiction has been caught up in this unfortunate turmoil, often with disastrous effects that have diminished our ability to tackle the addiction crisis. Addiction isn't the only condition that has suffered from the lack of a consensus definition of what constitutes a disease. For example, osteoporosis, which is the pathological thinning of the bones, was long considered to be nothing more than a normal, unavoidable part of aging, until it was officially recognized as a disease by the World Health Organization in 1994. Another unfortunate victim of the lack of a disease definition is homosexuality, which was long categorized as a pathological mental disease. Because of this, disastrous and humiliating attempts were made to cure homosexuality using hormone treatments, hypnosis followed by a trip to a brothel, electroshock therapy, testicle transplants, shocks to the genitals while looking at gay porn, and even brain surgery. It wasn't until 1974 that homosexuality was officially declassified as a disease by the American Psychiatric Association. As you can see, the process of determining what qualifies as a disease often has very little to do with science. Sadly, government and private industry are often given undue influence over what's defined as a disease for reasons that have nothing to do with the best interests of the public. It often boils down to profit, such as insurance liabilities or pharmaceutical sales. This has very much been the case with addiction, where much of the opposition to the acceptance of addiction as a disease is motivated by political and profitability concerns, rather than by medical science. Insurance companies have tried to dodge the billions of dollars in payments to cover addiction treatment and time off work to recovery, and therefore oppose defining addiction as a disease. Likewise, government policymakers have also often opposed the medicalization of addiction. Their opposition is based on various motivations, including the powerful lobbies of the health insurance industry and the privatized prison system. The social stigma of addiction and other mental disorders represents another barrier to the acceptance of the disease model of addiction. Throughout the general public and even among healthcare professionals, addiction remains widely stigmatized as a failing of morality or just bad decision-making, rather than a pathological brain affliction. Even if that were so, it would not preclude the classification of addiction as a disease. The most common type of lung cancer, for example, is uncommon outside of people who smoke, and few people would deprive lung cancer of disease status because it's based on a decision to use tobacco. The stigma of addiction has been worsened by the so-called war on drugs. While the superhuman efforts of the men and women of the various agencies involved in efforts to eliminate sources of production, importation, and distribution of drugs is laudable, policymakers also declared war on individual substance users by making possession of drugs for personal use a criminal offense. The term war on drugs has disappeared from official use, having been dropped during the Obama administration. However, simple possession of drugs for personal use remains a crime in America and many other countries. This policy diverts people with addiction away from the medical system and instead channels them into the criminal justice system. With addiction being criminalized, people who are already socially isolated and marginalized have been driven even further underground. Many people who suffer from addiction refuse to admit to their problem or even discuss it with their doctor for fear of being reported or arrested. Fear of arrest keeps many from calling for help in overdose situations, and the criminalization of addiction has therefore almost certainly contributed to the huge overdose death rate. I recently conducted a survey among addicts at a safe injection site, and only 1 in 5 said they would call for help if they or a friend were overdosing. In every case, they said it was because of fear of arrest. The point here is that there are powerful forces at work to keep up the negative stigma against those who suffer from addiction, and this stigma plays a significant role in closing people's mind to the concept of addiction as a disease. People view addiction as a crime rather than an illness. Acceptance of the disease model of addiction is a step toward reducing the stigma of substance addiction and moving addiction from the criminal justice system to the medical system where it belongs. However, speaking strictly from a medical perspective, as we've discussed, addiction does indeed qualify as a disease. The disease model of addiction is important for several reasons. First of all, it helps medical practitioners and researchers to frame addiction in the proper context and to give it the attention it deserves. It also opens the door for medical insurance organizations to provide coverage for treatment and for employers to provide sick leave for treatment and recovery. As well, the disease model is an important step in reducing the stigma that's attached to addiction, so that people at all levels of society can realize that addiction is a matter of biology, not a failing of morality or a weakness of character. Systemic biases can also be reduced by using the disease model as a framework for understanding addiction. For example, employers who understand addiction as a disease are more likely to hire people who are in recovery from addiction when they realize that the person was afflicted with a disease and not possessed of a weakness of character or a flawed personality. Companies are also more likely to view employees who develop addiction as treatable, rather than a lost cause suitable only for firing. Policymakers are more likely to make changes to keep people arrested for simple drug possession out of prisons and jail, and to make funds for treatment more widely available so that people have a way out when they're ready to accept help. The disease model is a major tool for helping to end the enduring effects of the destructive war on drugs that channeled substance users into the criminal justice system. The disease model also helps people who are suffering from active addiction to understand that there is treatment available and that remission and recovery is possible. Many don't see that and won't seek or accept help because they believe they're not capable of recovery. When society sees them as criminals rather than as people with a treatable medical condition, they're likely to see themselves the same way. The disease model of addiction offers benefits that will help us fight the addiction epidemic. However, Viewing addiction as a disease boils down to a simple matter of science. When addiction is viewed through the lens of science and without the fog of societal stigma, it is fundamentally a disease process where susceptible individuals have their health altered by a foreign substance that uses the body's natural physiological processes to propagate itself. Whether you're someone who suffers from addiction, or you're in recovery, or you're the loved one of someone with addiction, please check out these and my other books on Amazon and other booksellers. If you found this video useful, please hit the like button so that more people will be able to see the video. Please check out my other videos, and I've included links in the description below. If you'd like to be notified as my upcoming videos are released, please hit the subscribe button. Thank you.